So let's talk about some of the other hormones. So you have your gonads. These are sex glands and they refer to the ovaries and testes, which produce ova and sperm. So the ovaries secrete two female sex hormones, your estrogen and progesterone. And a female appears female primarily because of estrogen. Then you have the testes that secrete testosterone. You have your thymus gland. It secretes thymosins, which play a role in the immune system. Your pineal gland is called the body's biological clock, and it controls many biorhythms. It secretes melatonin, which affects the reproductive cycle, so it's released during puberty. It plays a role in the sleep-wake cycle, so the amount of melatonin secreted is related to the amount of daylight. So it's secreted lowest at day and the highest at night. Elevated melatonin levels can cause a depression called seasonal affective disorder, and that occurs in most places where daylight hours are shorter during the winter season. So places such as Alaska. Other specific hormones. So hormone secreting cells in the digestive tract, they secrete your cholecytokine and gastrin, which help regulate digestion. You have the kidneys that secrete erythropoietin, which helps regulate the RBC production. You have the liver that secretes insulin-like growth factor, which mediates the action of growth hormone. Prostaglandins. These are hormones derived from a fatty acid called the arachidonic acid. And prostaglandins play a role in the regulation of smooth muscle contraction and the inflammatory process. So they also increase sensitivity of nerve endings to pain. So your drugs such as aspirin and ibuprofen, they block the synthesis of prostaglandins and are therefore used in relieving pain and inflammation. Let's talk about adipose tissue hormones. So excess adipose tissue, it acts as a gland, and it's called the nasty gland, and it secretes hormones called the cytokines. So the cytokines cause blood vessels to become narrow, and they also stimulate the immune system, causing inflammation, which is an important risk factor for heart disease. So the cytokines, they contribute to the development of heart disease, diabetes mellitus, cancer, and joint disease. So in diabetes mellitus, adipose tissue secretes several cytokines that adversely affect glucose metabolism and predispose the person to type 2 diabetes mellitus. Cytokines oppose the action of insulin, which decreases the transport of glucose into the cells. Cytokines stimulate the liver to make excess glucose. Cytokines make the obese person resistant to insulin. So we've just completed chapter 14, A&P, the endocrine system. So there is a A&P quiz that I want you to click on. If you haven't already watched all 8 parts of the A&P series, go back and do so. And I'll see you over there at the A&P quiz.